You buy the trending serum, commit to the routine for months, and still see the same reflection in the mirror. The product just slides off. Generic drugstore formulas often lack the clinical-grade active percentages required to actually penetrate thicker or melanin-rich skin. They are mass-produced to sit comfortably on the surface, which prevents them from reaching the deeper layers where true change occurs. This scorecard illustrates the generic skincare trap. You apply formulas that are non-penetrating, rarely tested on melanin-rich skin, and lacking medical-grade actives. The cost compounds over time. You burn cash on endless restocking, while weak, unbalanced formulas actively compromise your skin's natural barrier. Relying on the standard cosmetic aisle to fix a real biological concern is an uncalculated risk to your skin's architecture. Beleza Skin Aesthetics in Nairobi offers a precise alternative. This is a dedicated hub for calculated, professional-grade skin transformations. Instead of following marketing hype, the focus here is strictly on medical-grade formulas. These are highly engineered, targeted products designed to do what over-the-counter cosmetics cannot: create structural change. Achieving that change requires a strict two-pillar approach. You combine specialized in-clinic treatments with a rigorous, curated at-home maintenance routine. This path requires a trade-off. You exchange the convenience of cheap impulse buys for a higher financial investment and strict daily discipline. When you make that commitment, professional clinical protocols engineer true skin confidence. Skincare moves from a daily gamble into a predictable biological investment. Let's look at exactly how this works for specific concerns, starting with stubborn hyperpigmentation and overall skin dullness. This decision tree shows our clinical roadmap. We eliminate the guesswork entirely. The first mandatory input happens in the clinic. We utilize targeted chemical peels designed specifically for controlled melanin inhibition, lifting pigmentation without causing trauma to the tissue. To sustain that cellular turnover at home, the protocol calls for specific clinical actives like the Maline 02 Ethnic Skin Night Cream and a 15% vitamin C serum from Fundamentals. The protocol requires absolute, non-negotiable daily SPF compliance. Premium protectors from La Roche-Posay or Dr. Estee shield those vulnerable new cells from further damage. This controlled scientific approach avoids the extreme dangers associated with unregulated bleaching agents, which often destroy the skin's structural integrity. Safely erasing hyperpigmentation on melanin-rich skin requires trading the desire for an overnight fix for the disciplined patience of a medical-grade protocol. For those trapped in a cycle of persistent acne and active barrier damage, the approach shifts towards structural repair. As this map resets, the strategy moves away from drying out surface blemishes and focuses directly on treating underlying inflammation and structural damage. The in-clinic input pairs hydrofacials for deep pore extraction with LED therapy, which works to halt localized inflammation. Your at-home repair input utilizes the Dr. Estee AC Control Mousse and the fundamental 1% ceramide serum to rebuild your skin's defenses. Strengthening the lipid barrier, your skin's protective outer layer, is the biological requirement for permanently stopping the acne cycle from repeating. The psychological trade-off is simple but difficult. You must sacrifice the tight, squeaky clean feeling of harsh drugstore scrubs and fully commit to a hydration-first routine. Curing severe acne is a rebuilding task, not an eradication task. It demands premium lipid repair over cheap astringents. Our final pathway addresses individuals seeking to reverse structural aging and combat hair thinning. Here, the chart shifts away from topical, surface-level treatments entirely, moving toward deeper, structural bioinvestments. The clinic input is microneedling. This triggers the body's natural collagen and structural repair mechanisms. Creating that new structure requires specific raw materials. Committing to daily premium supplements like Vital Proteins collagen peptides feeds the process from the inside. This systemic approach then integrates with specific topical protocols, applying the ExoGrow hair system directly to support follicle density. The lifestyle trade-off requires daily routine integration. You are no longer just applying a cream. You are mixing powders and taking capsules as a built-in part of your day. Reversing signs of aging requires a systemic biological investment, providing premium inside-out support rather than a temporary cosmetic cover-up. This matrix shows the clear divergence between the two approaches. The generic route starts with a low cost, but yields poor predictability and long-term return. In contrast, the Bellezza protocol requires a premium upfront investment, securing high predictability and formulas explicitly tailored to melanin-rich skin. This path is not for everyone. If you are seeking cheap, instant, or superficial cosmetic fixes, these protocols will not suit you. But if you value your time, demand scientifically proven safety, and invest in expert-led care, this system is built for you. Bellezza Skin Aesthetics offers a definitive, luxurious exit from the frustrating cycle of skincare guesswork. Book your session today and glow with confidence.